So, we are covering a couple of things today, and I know a number of folks are joining. I got to get on to be able to see what people are saying. It'll take me a second with that. We are going to be joined by Gene Bestel. He unfortunately got pulled into something and will not be joining until the top of the hour. So, for anybody that came on for that particular deep dive, he will be here in 30 minutes. But there's a lot to catch up on nonetheless in the meantime. So, and I was hoping we could cover a couple things up front for Gene before Gene goes or comes on. So, one, Clover Health made a big announcement with claim sharing, and that's something that I know Gene can hit on. I want to talk about our friend Andrew Choi for a minute, partly because, well, I'll share that. And then the other thing I wouldn't mind riffing for a few minutes about is the Maha Elevate model that was released on Friday after we had our live stream. How about you? What do you want to talk about
Sounds like a
beyond?
good list. There are too many things going on at once.
Yes, I'm with you on that. I texted somebody. I think I've sent three different texts that has said, "I feel like I'm living Mr. Toad's Wild Ride." That is pretty much every day I wake up, and I don't it, and it's even in sleep. Like, I am not kidding you that I have a new REM sleep that is it has a new dream state that somehow incorporates AI dialogue into it now.
Um, well, independent of that, I think there are a series of things that we as a community need to address, and that is that um, all the trends are for growth on food wellness, food is health. Um, CPGs, we're in a mode of saying we've got to change our food to be able to address GLP-1. That was an incremental attempt, and now I think they're realizing that they've got to change it fundamentally. I have heard, if there are any CPGs paying attention, I've heard that all the major CPGs are all thinking about how should they work with the supply chain to improve nutritional density, and they're having those conversations. They are not universally talking to the companies that actually can deliver that. So we're in a mode where different parts of the value chain, whether you're in grocery or CPG or farmer, saying that you can deliver better nutrition, there is simply not enough conversation going on between those groups because they can't connect. It's our responsibility to connect them. But if we as we as a community focused on food is health want to achieve food is health, we're in a process right now of connecting the dots between people, and it's not happening. And I feel like you and I are failing at this. With self-reflection, but we now have a community of nearly 15,000 people on the newsletter. So there's interest, and the thing we need help with is, every CPG out there should know that Audacious can measure nutritional quality and density in the food. And Audacious can't spend its entire life educating all those people. If it should, I guess, as a startup, but it has a responsibility to do that. But on the other side, telling CPGs to go look at those companies and us connecting the dots so that they can start actually transacting. Where we have heard, there's certainly in places like Indiana's moving very fast on their One Health initiative, which is a recognition that the biology associated with livestock, with crops, and with humans is very similar. And that folks like Lilly and Corteva should be working together to understand what that looks like. On the other side, the CPGs and grocery and people in the food industry similarly need to come together and recognize that the business model of better food takes market share from healthcare and gives opportunity, and they've got to start digging in.
Well, that's where the missing link is. That's what I saw firsthand at Expo West. I mean, I'm with you that we've fallen short on that particular mark, but we've been going after 3 separate industries at once. So I'm going to try to give myself a little bit of grace.
Whatever. But if bridge is on fire, problem needs to be solved.
Agreed.
What do we have? We have 15,000 people reading our stuff. If those 15,000 people reach out to people they know in those industries and saying, you should be paying attention, and if you want to get connected, and we will make the connections. We have, whenever I sit down with a CPG on this topic, whenever we sit down with healthcare on this,
I know,
we immediately are able to provide 10 people they did not know about who are critical to them. They're the answer to the question. They're sitting in a room with McKinsey or somebody going, well, I think we should figure out how to do X. And X is being solved by somebody else in the room next door, and they don't know each other.
I know.
So it is that stupid and that simple to fix. And this even relates up to the government level. I mean, we are getting distracted on things at that level. And it's time to circle back. Everybody's sort of confused about, oh, well, RFK maybe doesn't care because he made a roundup decision. He made a practical roundup decision to get forward at this instant in time. Don't get distracted by that crap. What we need to do is, the conversation that Kennedy is on is fix soil health, fix human health. Get the roundup thing out of the way, because the other choice was to go to crap that was going to be worse. But what we need to do, it's not going to be the government that does this. The government only reacts to the things that we create. We as a community need to connect the dots, and CPGs, if you know somebody in a CPG, ask them what they're doing about this, and let's get them connected to the startups that can show them how it's done. We can build supply chains that deliver nutritional density to the supply chain necessary for CPGs. It may take a little while to get it going, but we're talking about $1 trillion industry. So yeah, it's going to take a couple of years to get it all going perfectly. And in the near term, it can work okay. Like, grow up. Yes, big things take a while to get worked out, but they start with the first step. So,
okay. So let's shift to an example of a first step. Let's talk about Andrew Toy for a minute. Unless you want to talk more about that. I'm with you. The good news is that Ellis McHugh will be here with me tomorrow. So, and we were already planning on hopping on a call with Carmen Brace. And so those two, I mean, we should be able to dive bomb the CPG industry between those two. So thank you for this, because I will just play this for Ellis when I pick her up from the train in the morning. And I think by the time she leaves my house, Carter, she'll have solved for it.
Okay.
Right? I mean, Ellis. If anybody can pull that one off, Ellis can. So there you go. So
the equation, but Ellis is like, 100.
I know. I'm just saying though, like
yes, that's a good step. But everybody else out there, time to turn the megaphone on.
Okay.
We don't need to. We got to stop. This is not a complaint about us internally, other than the angst that I'm feeling that there's an opportunity here. This is right in front of us.
I understand. I'm with you. I'm echoing for some reason.
You're echoing?
Yeah, your voice is doing that weird thing today where it's kind of like I can hear it and then I can't hear it as much. You know how it did that weird volume thing the other day? It's kind of doing that, but let's not stress about it. Okay. So I'm going to jump into Clover for a second, and this is going to be helpful for me because I want to use this clip to put a preamble on a podcast episode that I recorded, interestingly enough, close to a year ago with Andrew. So on the Reverse Mullet platform, which, I also own, whatever you want to call it, we recorded an episode with him back in April of last year, and we talked AI. And it was a fantastic episode. And I never produced it because I threw all my energy over into this. And I realized when Clover made the announcement. So I don't know if you saw, there's a lot of hubbub in healthcare about Clover and their announcement. So there's new legislation going live in July, new mandates from CMS around what's called TEFCA. And it is really, the government is saying, like, look, it is not okay where we stand in terms of people having access to their health data. I mean, RFK has stood on this, Oz has stood up on this, Chris Plump. I mean, everybody has said, like, we got to do better. Last summer or last fall, I was actually up in DC with Monique from Eat Love at one of the first ONC TEFCA kind of meetings to say, like, you guys, we got to figure this stuff out. Fast forward, and Clover partnered with another organization and became the first health insurance company, aka payer, live on what CMS is calling their aligned network and TEFCA. And what that means is that they are enabling patients to securely authenticate and request their information from any participating payer through a connected network. So all the payers are supposed to get online so that people have access to their claims data, which this is a good tee up for the conversation we're going to have with Gene. Anyways, I wanted to riff with you for a second because that prompted me to remember the fantastic conversation that I had with Andrew where we talked about AI and go back to that episode to see if it's still relevant. And guess what? Other than one little piece that was talking about hallucinations that really don't happen in AI anymore, was extraordinarily relevant. And so I want to put it out there for our Food is Health crowd, for our tribe, and also put it out for Reverse Mullet. But you're a big fan of Andrew as well. We've met with him a couple of times. Yeah. And what is your sort of take on this, if any? So because I want to use this to put at the front of this episode so people understand why I'm publishing or putting out an episode that's old, just because I think it's really relevant, in particular because Clover continues to take a leadership role.
Like, I don't know. Consumers should have their data, and then now consumers will only do so much with it. So that means consumers, then people are going to be like, should I give this data to other people? And I think we have, who has the data? What's happening in the data? Will somebody use the data to my disadvantage? There's so much we've wrapped up in HIPAA. That the data model, I think that technically makes sense is consumers have access to their data, have their data and give permission back. Technically, this is possible. You can set things up so that you have a digital wallet of sorts for your information, and you permit other people to have access to it, and you permit. And I think that the people who are less worried, that a special job for those people that are not so worried about data rights is to do more with the data. Now, I saw yesterday a startup that optimizes it's one of these gym apps that optimizes for your output. So they optimize for VO2 max. So they're not trying to make you look good. They're you say, I'm trying to optimize my VO2 max. How do I optimize my VO2 max? Which is another variation on this, but the idea is that the early adopters here are really important, because what they're going to do is they're going to demonstrate, these are the 10 things I do, and here are my measures and my outcome. And then what we need them to do is share that information as broadly as they possibly can so that other people catch on, and that we keep the ball moving forward, that I can gather this data, I can empower myself, I can make decisions, I can get better agency, and then the business models will build on top of that. It's going to be crazy at first. So we saw a guy in Australia sequenced his dogs with cancer, and used it to fashion an mRNA vaccine. That was $3,000 of assay. I don't know exactly what lab he used to do it, but anyway, he used some kind of lab to do it. And he used Grok and AlphaFold to design that. No biology background, and then he gave it to the dog, and the cancer reduced. Round trip cost $10,000. So that triggered a whole series of stuff. There was a great thread that went into a lot of depth on this is how you treat cancer. That's not how you treat cancer. You need to do RCTs. You need to do this. And everything in that thread was technically correct. I also pointed out that cancers in dog is different. It is.
Mm-hmm.
But if you change your lane from a treatment standpoint to peptides, that is a more direct solution. Peptides are signaling. All they do is signal your body to do things in a sense. And so the target effects are a little more limited and the mechanisms are better understood. So, okay, maybe cancer is not the first target. But then the other thing is there's so many people that fail on cancer treatments. And if there are a class of these types of efforts that could be designed that maybe don't have off-target effects, all of a sudden you've opened the envelope of the amount of people testing. And what it does is right now that sequencing that he did for $3,000 probably in 2000 cost $2 billion.
Exactly.
And then we're trying to drive that price down even further. So all of a sudden, then we had this problem with the MRIs where Musk said, "Oh, everybody should get an MRI," and people said, "Well, it's too expensive, so you shouldn't do it." Well, Musk was probably thinking that MRIs are going to be $100. Well,
Exactly.
MRIs are on their way to become $100. So once MRIs are $100, once sequencing is $100, once your ability to design an mRNA vaccine is $100, once that market emerges, will the decision on how you approve and when you do it, what will that world look like? And that is the world we're moving to. And that is the world that we should be designing to. I realize that there are frustrations now near term, but we're not sitting here trying to solve tomorrow's problem. We're trying to solve the fact that we spent 70 years getting ourselves into this mess and it's going to take 20 years to get out. Anyway, I'm ranting.
No, it's helpful. So
Amazing that I had the gumption to do that. So now imagine actually if he's a domain expert. If you put that into a cancer person who's a domain expert who's trying to figure that out, like if you give Bob Lustig that kind of capability that he can express out drugs and do tests like that and steer the AI, what is that?
It unlocks, every time you use AI in the context beyond a glorified search engine and you really start to use it for what it's built to be able to provide, again, using AI at the top of its license, not the bottom, just like humans were trying to do, the paradigms that our minuscule tokenized brains can handle, right? You see these flashes where you're like, wow, what if we did this? What if we did that? Which goes back to your point about CPGs. Like, we have what we need now. It's just a matter of getting the right context window, connecting the right dots, right? Like, it's literally putting the right information into the engine and engaging the right parts. There is no more, like, I don't believe we need anything else, really. I'm sure there's
going away. And I am very triggered by a conversation I had yesterday where somebody who's close to several CPGs is like, "Oh yeah, they're thinking about this and thinking of going forward." It's like the 6 CPGs that they listed, none of them are engaged with who I know are the best people in delivering nutrition to the value chain. And it feels like there's a formality in the way. Like, oh, well, we're a big company and we're not ready to work with small companies.
I agree with. There is a strange sort of, McKinsey's worthy of redesigning this kind of market and, this and this and this. And it's like, but whatever. All right, let's not go down that path. We have 8 more minutes. So let me take to another interesting, let me add. So Chris Narian's on and he had some points to make about what we just talked about with Clover, before I add those, I want to add another contextual element into this. Again, these are news items that I think even healthcare, it gets kind of caught up in, but it gets caught up in it in a system B frame. So it's like, again, downstream. Like, what are the implications whenever we're handling health purely at a downstream level? When you unlock your brain to focus on it at an upstream level and tying outcomes to things at the food level, changing the paradigm, like I'm going to tie one last element in before I tell you this piece, because it's an important contextual item, which is my husband, he was diligent about reading everything going on in the world in the morning while I'm blissfully unaware. And he sent me a note this morning about, this viral, I guess it's a viral video that highlights that healthcare costs are causing Americans to cut back on essentials. And it's basically 1 in 3 Americans are now cutting back on daily expenses to afford healthcare. If we could show Americans the upstream before the downstream that they need to spend their money on, right? Talk about shifting market share back. Consumers want nothing more than to be able to be healthy on the upstream side. They don't want to have to put the money on the downstream healthcare side. And what we're talking about is solving this systemically. Like, this isn't some like thesis that you and I are still kicking around. Like, this is the legit answer to how we get ourselves out of this mess of 1 in 3 Americans. And I would say it's probably more than 1 in 3 Americans, right? And so I think this was a really interesting advancement. People are kind of dogging it. I think they're really overlooking what's happening here is Amazon is, right, just like what we've talked about, they're seizing the opportunity with agentic healthcare. I mean, like, you've seen what I've done with Claude, and now we have our own agents and we see what we can do, and we're just not even trying, right? So Amazon announced that it's expanding to basically have a healthcare AI assistant, Health AI, to its website and app. It was previously only available to One Medical members. And so rather than acting as a generic symptom checker, it connects to the nationwide HIE, ingests a patient's longitudinal medical history, labs, and medications, and combining with relevant Amazon retail purchases to provide highly personalized context-aware triage. That, to me, is pure bridging the gap between System B and System C. That's building infrastructure that unleashes System C.
Right? What data do we need to assemble? So we have the networks. We have fooled around with AI enough that I think at this point we could build a pitch book of innovations around the space. I've sort of built the raw infrastructure for that. I've taken the 6,000 startups that we've talked to and have that, so we understand that's, call that sort of proprietary data or data that not many people know about. We have a lot of the blanks on what firms need to be involved. I think we're ready to probably turn that into a database. It does.
I agree. We're ready for Hayek.
I do got to figure out a bit what, I mean, it's a real cost. We do have the capability. So I was thinking last night, we could take the agents that we've built and have them go out and sort through who are some of the leaders that maybe are making these decisions. And then we've got to figure out how to get those leaders to just like lower their force field a little bit. And learn to talk to other parts of the supply chain that they've never talked to before. But I do think that it's time to, we can start building that database and then making that available to people to start pulling the connections together. First version will be a little rough. So if people have got thoughts about what we should do to that, so the best way to make that product better is feedback. So anybody out there who's like, you know what, these are the connections I need to make, and I'm not making them, and I'm failing for these reasons. It would be good to get that feedback from our readers.
But to get to System C, I just want to be very clear. Like, we're not interested in building something for you to pitch more System B and throw more money at a system that's not working.
But I've been kicking around the idea of something under the label of Hayek, which is sort of a food is health CRM in a sense. So that anybody who's trying to optimize System C for food is health has got that network of information available to them.
Right. And then the more intelligent that we make that network, then the more, and that's what we've seen with the agents that we've built that you're talking about, is that it is not difficult to train them to basically capitalize on their 50-to-1 token advantage to the human brain.
Yeah.
So let me add a couple of comments here. I know Gene will join soon, but this is a very good tee up for the sort of brass tacks conversation we're gonna have with Gene. And then, by the way, Gen, our favorite Gen Gillespie, is going to join us. We finally confirmed, assuming your calendar is not a barrier, which I don't think it is next Thursday afternoon. He can join us for a live stream. It's the only hour and a half he's got, but he set it aside for us. So hopefully it works for you. I will check after the fact. But technically on this one, Gen and I could riff, just the two of us, if we need to. So I think I will take that slot with him. So there's two things that I wanted to give you here. So first, Chris Narian, who has Metakarma, and he is very much in this space of personalized health data, AI, using it to help you to manage your chronic conditions. He's one of the first in this space. He threw a couple of comments in here. I know Chris well, I know Metakarma well. He said, and this was in regard to the Clover piece, was most IAS guys are not getting as good at the data as treatment path, and it's because of inadequate coverage and complete data, and that also most people don't know what to do with their data. Case in point, Apple Health for decades. I will let you comment on that, Carter. I will push back a little on the Apple Health data. I think it is what my experience now that I am engaging with Claude with my own health data. Some of you heard me just go off on Friday about how helpful it was with my viral infection last week. It was a sinus thing. Hygiene is what I have now learned is I have, in essence, sort of created a health wallet of my own. Those are tools that are coming that will be secure, that will solve for a lot of things people are scared about. But in the meantime, I've created really my own health wallet on Claude. And case in point, I scheduled a visit with a virtual primary. I'm going to try virtual primary care health tap. We know those guys well. And Jeff Rutledge has finally gotten me to give it a try. So I have an appointment. We can. He's already gotten me to get the appointment tomorrow morning with a new doc. And again, I was facing that irritating friction point of new doc. I have to now give her all my records, right? And I don't have a health wallet, and this is really irritating. And there was a little 1,000 character box to give the doctor information, right? And I have 40 PDFs. So what did I do? I asked Claude, because I have a project, I've created this wallet. I said, I'm onboarding with a new primary care. You know my health conditions. I need a 1,000 character summary to give the doctor of my key biomarkers, what matters, how to onboard with this doctor. Boom. 30 seconds later, I had 1,000. I workshopped it a little bit to add a couple of things into it. Boom, done. I mean, you know how long it takes to try and sort through that, right? So the point is, that is an example of what people are going to have access to. So Apple never let people interact with their data like that. You had it in their universe, in their ecosystem, and you had to ingest and use it the way they did. And there was no place to really play with it outside of that. And I think that's where things have really changed, is you have that customization ability. The other comment I want to throw out, we'll finish the riffing and then Gene has joined, is Christo just put a comment in, very good comment, which is, what are the key this goes back to your point, Carter. What are the key choke points preventing people from truly leveraging their personal health data? Despite the explosion of information from medical records, labs, pharmacies, and wearables, most data remains fragmented across systems like Epic and Cerner and is often delivered in formats that are difficult to use. Even with access rights under the Health Insurance Portability and Accountability Act and interoperability standards like Fast Healthcare, like FHIR, which is FHIR, why is it still so hard for individuals to turn their own health data into clear, actionable insights? And that actually is the perfect question for Gene as well. I'm assuming he's jumping back on. I think he's having
Yeah, he's
technical
having trouble hearing. So I think the thing I'd like everyone to, as we crank through this, yes, it would be nice if the standards were right. Yes, it would be. All those things would be nice. But the reality is, you can take screen captures, drop it into Claude, and get 80% of the way there. So, the technology, once the demand reveals itself, the technology will adapt. Once more people are coming back and saying, I'm getting healthier, I mean, we really need to start seeing an RCT or some type of controlled study that says people that use these tools have an improvement in their health.
Yes.
But
Yes.
in the interim, what's going to happen, and we just need to get over, is instead of waiting for somebody else's permission to do it, is just go ahead and start using the tools and exposing the cases.
I agree.
We've
And
got
that's why I've dove in. Gene, can you hear us? Gene is not able to hear us.
Okay.
Can you guys hear me?
We can hear
I can't
you.
hear anything.
We can hear you. So it's on your end.
Okay. So let me let him know we can hear him. All right. So why don't do you want to unpack any of that further while I send Gene a note here? I'll text him. So how can we help people with that, Carter?
I don't know that we can. I think we've given people examples. Pick it up and try it.
How can we collect that data?
Hallelujah.
Oh, there we go. Okay, Gene's on.
Yes.
Okay,
I don't know what happened, but
it's okay. So Gene, I'm gonna summarize a point that somebody just made that I think is the perfect tee up, and Carter said it as well, which is, because I think you're going to address this, is talking about the key choke points preventing people from truly leveraging their personal health data. And he references the fragmentation across all the different sources like Epic and Cerner. He talks about access rights under HIPAA, under FHIR, the interoperability standards under FHIR, which is something that you have Substack that's called. You're like named after that piece, right? I have my own answer. I don't want to dive into why it's so hard. I want you to show what you've unlocked. This is how we met. We've got 54 minutes, and I think we should make the absolute best use of it. What you showed Carter and I in terms of what you built was fantastic. And I know that's why a lot of people jumped onto this, because they wanted to see that. I mean, you took, I've gone really deep into creating my own doctor, basically, my own primary care through Claude. You have created a family dashboard for health claims. You've taken a whole different approach. And I really wanted you to walk folks through that. If you want to take a couple minutes and introduce yourself, and then let's dive in. Share your screen and let's go for it.
Yeah. Hey, I'm Gene. I'm known as the FHIR data guy on Substack, but I'm a data guy that's been in healthcare for like between 15 and 20 years now. So worked at all the different areas of healthcare system, from pharmacy to health systems to health insurance. to digital health platforms, and I built analytics and interoperability solutions and things like that, as well as worked a lot on quality measurement and things like that as well. So really kind of like looking at the data and how does data play a part in, everything from reimbursement to outcomes and things like that. So yeah, I'm excited to show some things as Ellen has alert to this, but like there's a lot of fragmentation in healthcare, and like I have my own example of that where my personal health information is sitting in many different databases essentially at different providers. So like one of them is a large health system. Actually, another one is a small primary care practice, and they use a system that's essentially disconnected from everything else, right? So what I had to do is I had to overcome that by using AI to help me aggregate that data effectively.
So let me jump in for a second. Two quick things on that. So one, I think that the health wallets that are being built, I know HealthX is really focused on this. We've talked with them a couple times. They have a really great vision of what's going to happen there. I think that's going to really be an example. It's not just going to be HealthX. There will be multiples of creating a health wallet that solves for the security, the fragmentation, all of that. But you hit on a point that is a bottleneck. Carter, you talked about how long it's going to take to overcome some of this. We've built a very opaque, disconnected infrastructure really, really deep in a downstream economy. And a perfect example of this is, and I learned this actually with Chris Narian, who's on, is I knew it, but I really experienced it firsthand, is things like Cerner and Epic, they are acute care EMRs, basically, electronic health records, electronic medical records, whatever you want to call them, right? But they're acute and they're big and they're typically Epic. They're truly Epic, right? They're under Epic or they're under Cerner. And Epic it's built very opaquely. And they have decided to take a very incumbent, strip different capabilities away from people. Like they've really gotten even more insulated and private and, not playing nice in the sandbox. I mean, they literally pretty much shut their quote unquote proverbial sandbox down. Now, you referenced the individual primary care, and I ran into this. I don't go to big health systems. I know this would come as no surprise to anybody who has followed our Substack, right? I go to everybody knows, not just obscure concierge docs or functional docs. Like I do go to regular endocrinologists, OBGYN, whatever, but they're typically at most in a multi-specialty practice. They are not health system based, typically docs. Those docs are on ambulatory EMRs. So yes, Athena is one that's a big one. So they do tend to operate like an Epic and Cerner in terms of having data for people to be able to scrape or give. But when you step lower to that like 900 ambulatory EMR providers, that's what we're talking about here that nobody has really necessarily solved for. But when you have multiple, VC-backed firms that are focused solely on creating these health data wallets, it's only a matter of time. So I just want to give that context for folks of what we're talking about when you give that example. And then why don't you share?
Yeah, absolutely. And you mentioned, companies like HealthX, and they're leveraging, something called TEFCO, which is the infrastructure that's been set up in the last couple of years to essentially take all those disconnected systems, and they were called health information networks, which were regional or state-based, and they're designed to connect them via national health record exchange. So, but as I, was talking about this, not everybody's on the system. So like my primary care provider is not on that system at all because they're such a small niche player that they're not connected yet, but they will be, right? So it's important to say, like, not to be critical, but like we have made a tremendous amount of progress, but it's still ways away from being comprehensive. So like think about 30-40% of practices in hospitals are on that system currently. And then there's something called patient right of access. So patient right of access came about from via the Cures Act, right, in 2021, where essentially it was put into law that, you as a patient are allowed and empowered to connect to your data. And there's a list of essentially data elements that's called USCDI that is provided via that, right? So it's not everything. Just please understand, it's not everything. And we've had other regulations that do let you access actually everything that your provider has, but that's handled under a separate provision that's called EHI extract. So EHI extract is kind of like going to your provider and filling out a form and saying, just give me a dump of literally everything you have on me from your systems. And that actually requires like a whole different process. And this is not this.
Well, Chris,
Yeah.
made a point. And then once I make this, I just want, why don't you pop up your screen while I talk about this for a second? So I agree with Chris. Chris says matter of time equals 2 years, question mark, 5 years, question mark, decades. There's an obvious solution for this that's not being talked about. And that I agree with Chris. I think that most folks are really focused on this downstream. How do we play within the existing infrastructure? I think when you start talking about bidirectional and you start engaging consumers and you give them license and you start to engage docs and take away some of these provisions. So the example, Gene, that you just made of your primary care, who the hell cares if he gets on some interoperability piece, right? All you care about is if you have a health wallet, you just want to know you want a summary visit, right? If he had the ability, if we can just simplify things and you're able to just get what you need from him, right? That's what's going to end up happening. I mean, even if, let's just play this out. Let's say we get our own AI wallets. You can have your own friggin' AI scribe in the room, right? Your doctor has an AI scribe that's creating your EHR that then you don't even get the record on. Well, if there's a consumer facing, this is why Carter and I keep talking about, we have to move upstream to consumers, is if you have access to your own scribe sitting in that exam room that gets automatically uploaded into your health wallet, you just circumvented it. So Chris, that's just an example of what I'm talking about. And there's a million different ways that we could skin the proverbial cat on this, but that's an example. So can you make it a little bit bigger, Gene? Can you zoom in some so people
And I
can
want
see
to
this?
actually present both the insurance
Awesome.
side and the clinical side by side. So just give me a second so I can do that.
Yeah. Just so everybody knows, this Gene created his own. So, I've shared with everybody my 3 different 17-page health reports and protocols. And so Gene went a different route, has some of that, but actually built a family health insurance wallet and analysis that you guys are seeing. He's going to share with us.
Yeah, and I have like 2. Oops.
If anybody wants to weigh in and say if they need it to go a little bit bigger, or if this is manageable, that would be helpful.
Okay, so I'll just do this. Okay, so so basically, what we're talking about is there's I created a clinical dashboard and a
so it's hard to
insurance
see,
dashboard.
just so you know, it is hard to see both side by side. Like we see them, but it's best if you open one at a time.
Okay, let me do that. Okay, so anyway, I was able to download my data, which is anybody can go on FlexSpa. FlexSpa is the company, and it can post a link, and you can connect to your health insurance company and pull in, whichever insurance you have. You can take all that data, and essentially that's the data that I fed into Claude. And I said, hey, this is what I'm looking for. So I want to see all the information about, how much we're spending, what were my providers, what is all the information that I have. So I just had a colonoscopy, and there was a whole bunch of different things that are, that were billed. I wanted to see everything in one place for my medications, things like that, and claims, and then also understand like what's top of mind. So I wanted to see everything in one place. And if you ever try to get this from your health insurance company, you have to actually log in separately with every your member of your family separately, and then you see all of their information separate. So I was able to just aggregate everything together and say, like, what are we talking about as a family, right? So I was able to create this, which is probably, this is like the first time I've been able to get this view from, essentially the last 2 years. But if you have data going back 5 years, if you've been with the same insurer, like, 5, 8 years, and you've had different procedures done, whatever, this is really pretty incredible to be able to do that. And then I'm not going to show, obviously, my other family members, but this is my 2 sons, Max and Henry, and this is my wife Stacy, and this is all of their kind of claims, right? So claims have a lot of information on them. They have, whether who's the provider, who's the system that you went to, what medications are you prescribed, right? Like all the different things that are very relevant in terms of managing your healthcare, right? So it's a big piece. And now let me show my.
So let me ask a question on that as you're pulling this other piece up. And then we'll go back to this at some point. But so before you joined, I teed this up with and then Chris has a very specific technical question, but Clover just announced. I think we might have talked about this briefly at HEMS, but Clover just announced they're the first payer to go live on TEFCA on the CMS claims platform, and it's bidirectional. Does that change anything for consumers, or is that just a payer-to-payer play at this moment? And then Chris had a question for you, which is, how did you get access to the data? Which I know you mentioned how you did, and who provided access and pay for FlexPa?
So FlexPa is a company that is a digital health company, essentially. So if you go to flexpa.com, anybody can access your data for free. So they're making it available. You can use their platform. They're actually a CMS healthcare health tech ecosystem member. They're participating in the CMS aligned networks. And so the example, Ellen, you're talking about, which is the Clover and announcement, is that they're sharing. This is the first payer to share their claims data using the TEFCA kind of like pipes, but under it's called the CMS aligned networks. So CMS aligned networks are like, kind of think about a speedboat that's going faster than the rest of the TEFCA ecosystem. The TEFCA ecosystem is kind of like a large, ocean liner that's going. It's very slow, but it's eventually going to get there. And then we have these CMS aligned networks, which are like the speedboats. They're trying to see how quickly can we get this data connected so that a payer like Clover can respond to inquiries on the national network and actually return your data as a patient. So this is all patient, right? So think about you as a patient requesting your information, right?
So the first step, if somebody wanted to do this, so Chris, just let us know if you have more questions on this. I should probably send Chris the link and he should jump in and ask all the questions, but I think I'll throw everybody off if I put another person into the conversation at this moment. Maybe we'll do that later. But so let's talk about this point for a second. So if somebody wanted to get this data, if they wanted to vibe code their own version of this, for example, is the first step to go into FlexPa?
So the first step is to like connect your data, right? So you want to, oops, I just can't align this properly, but let me just give me 1 second. So basically, you mentioned HealthX. HealthX is a company that allows you to do this and bring in your information. There we go. So, and connect it to your chatbot, so which is Claude in my case. So they just announced that they're also doing it with the Microsoft Copilot.
Correct.
And so you can go into Claude and you search for HealthX connector, and HealthX will guide you through connecting to your data using TEFCA There are also other ways to connect your data, which is if you go to, and we'll post all these links afterwards on the Substack. There's a Josh Mandel, he's been around for probably 10, 15 years working on all this FHIR standard stuff, right? He just actually released his own thing called Health Skills. Health Skills is just a way for Claude to connect to any EMR system. So like a system like Epic. So you can go in, it has a list of literally all the Epic connections. You can go in there, pick yours, put in
You
your
basically
password.
create your own. It's like a direct pipe to create your own health wallet into Claude
Correct.
without having to go to HealthX. And I will say, like, I think folks know my experience with HealthX back in January was that it did not find any of my data, not through the Claude connector. Now, there's a
Right.
separate way you can use HealthX, which is direct. In that example, it found some of my data, and then I was able to manually add. But at that moment in time, those two connectors were the connector with Claude and basically the kind of the wallet I built were separate, and you couldn't parse them together. So I ended up just going direct into Claude, creating a project, and dumping my own data into it. Which what you're saying is that's another way to do it.
Yeah, so like HealthX, so backing up a little bit, Anthropic came out with a thing called Health, and Anthropic Health. So it's essentially a way for you to bring in your health data into your Claude or AI agent without it being shared with anybody to respect your privacy of that data.
Correct.
So it's not being sent back to them, and they're not, using it in their training
So
models.
how did you
they're
get
not doing any of
over?
that.
Yep. So how did you get over the challenge of Chris pointed out, I've experienced it myself. So how did you get past the point of your doc, for example, did not come through the connector?
So what I did was I actually coded my own connector, and I created something to de-identify all my data, and I have it actually available on my GitHub as a MCP app. But essentially, I had to go to my EMR, my PCP's EMR system, and I had to figure out that, how do you access their patient right of access connection? So there's
Gotcha.
basically a portal. It's like portals. There's a million portals, right? Every provider, every system has a portal. So you have to find the one that your provider sends you when when you go to do the appointment. They send you an email, and there's like a link. Go create an account in this portal, right? So I had to do that, and then they usually have a way to programmatically log in and download all of your data, right? That's called
Gotcha.
the patient right of access, and they're required to make that available. If they don't, they're liable under information blocking rules that
Exactly.
are starting to be enforced right now. So
Yeah, and
I
so
was
that
able to
means
get all my data. Yep.
Anybody who decides to be advanced enough to try this, if you encounter a blockage, then you should 100% report it. There is a very easy way for you to do the information blocking report, and it's really important because that's key to unlocking all this stuff so that we can move further upstream. Okay,
But
so
Right.
rare occurrence
no, it's not a rare occurrence. It happens a lot.
that they can't download their data?
Correct. It's blocked a lot, which is why CMS has put a lot of resources into it, making it clear that that's not acceptable. And
Yeah,
even the
and
big
it's
players,
actually
the big players are being very aggressive about how they block it as well, even though they don't have to.
Yeah, and it's funny because it's actually the patients that are reporting information blocking more
Exactly.
so than anybody else. And so now you're seeing this like enforcement action. Well, then, people come up with all kinds of excuses like, oh, our systems were unavailable briefly, or yeah, you tried to access a link that was out of date. But it's technically still blocking, right? If you can't enable access to my data, you're blocking my ability to care for my own family, my own.
Absolutely.
You're right. So it's like that's been a big problem for a long time. And you can't imagine how complicated this stuff is too. Like they actually have not had a single directory of all of the connected connections to all the Epic even systems until about last year that they came out with that. So for a long time, it was just one by one by one by one. Like if you know your provider and you know their system, you could find their endpoint to connect to, right? But if you don't, you don't.
Hold on a second. The context I just want to bring up here is I don't want people going into this thinking that all their data is not available. 99% of the people that I talk to about this have never even logged into the patient portal.
Yes.
So before people start thinking, oh, someone's holding my data and I can't get it, let's get the first step of you log in. You can see your patient information typically. And if you're blocked on being able to download it, double check because you just may be in the wrong place. And then let's raise the issue. But if you haven't even logged into your EHR, most people don't even know what an EHR is. The data that is in there, I had this happen with a family member. Just the MRI written report. They were like, oh, do I need to give you the MRI scan? No, the MRI written report is enough. Screen copied was enough to deal with a particular, what next step question.
Yeah.
Yes.
And so
walk, run, leap. I get into
Yes.
the patient record, start looking around, and just screen copy the data if you can't export it. And that enough is often helpful for closing the gap on your information.
So, and just to go back, there was a question around, does TEFCA allow a patient to get health and lab data directly, or do I need to pull directly from EHR Consolidator? So it's the latter at this moment. It's built so that there's not as much blocking. I mean, Gene, I'll let you answer this.
Yeah. There's like they call them, what are the different use cases, right? That you can access TEFCA. One is treatment, which is your provider asking for data on your behalf for treatment to treat you, right? And then there's individual access requests. It's called IAS, and that's the way HealthX is connecting, right, through Fasten Health, which is another a company that's kind of doing the plumbing there. And then that's also how FlexPy is doing it through their connection. And then it's a combination of TEFCA plus those patient right of access, which is the direct connection to your EMR, right? So you may have to go both directions to be able to really get to your data, because not all providers are on TEFCA. You might have to go to your local provider and say, I need your portal, send me the link to your portal where I can register. And once you register, you create a password and username, you can access that data.
Okay, so let's back up for somebody that's listening to us, because we're all a little bit advanced here. We're jumping around. So let's go back to step one, because I don't want to overpromise and underdeliver here. I want to do my best at not underdelivering. So if you're watching, got a lot of people on today. So if you want to do this with your health data, the first step, would you say, Gene, would be set up, like, let's talk about Anthropic. I'm a big fan right now of Anthropic. OpenAI has said you have to get on a waiting list right now for their health stuff. So let's just talk Anthropic. You have to be on the $20. You have to be on the $20 a month plan at least. There's a $20 and $100. So if you're on the $20 a month plan, as Gene said, down on the sidebar there's a connector. Well, you're in Anthropic, right? Can you scroll over, Gene, so that to the left, and then, well, it's fine. I don't want to mess you up, but it's way over there. So you have a project set up, it looks like.
Yeah, basically. So what you're going to do is, let me just bring this up real quick.
You're going to turn the connector on, but then I want you to address very specifically, because this is 100% people need to understand, is should they go onto your GitHub? Option 2, now we got a stack of data, right? You're going to show them how to add the connector. So just everybody sees, right? Gene went down to the plus sign in chat, right? And then you went to connectors, and there's a HealthX.
Yeah.
Do you guys see there's a connector?
So you're going to
search.
So you're going to search, and you're going to add that. And then once you install it, then you just said, like, connect to my data.
And I would suggest you set up a project, not just do like a free flow chat here. Like it's fine to connect to data, but like to start to work with your health data at a minimum. So can you show, Gene, on your little thing up there how people set up? Because I know there's a lot of people on here that have not been playing around with Anthropic the way we have. Show people how to do so now you've got the connector. So Gene's showing how the connector is established. But if you go over, if you were going to set up a project for someone.
Yeah. So like when you search in the connectors, it'll bring it up as this HealthX beta, right? And then you can install it in
In
your
Beta. Exactly.
Yeah.
Now show people really quickly how you set up a project, just what that looks like in the chat piece, different from just a regular chat window.
I'm not sure what you mean. You
So
mean
up
like
to
a
the
project
left,
in
go
here?
up to the left there, that little box. Yeah, to projects.
Oh, you mean projects?
Yes.
Okay.
And
Yeah,
then
I don't
here,
really,
I would
I
suggest.
don't really use.
Okay,
Yeah, I don't
I
really
do
use that.
I do
Yeah.
just because I have so many different context libraries going.
Yeah.
So if you go over to projects, go back for a second, just for people's, if you do new project, you don't have to do all this, but if you set up a new project, you can name it, just say, HealthX or whatever. And then you see over to the right there, Gene, with files. This is a nice way if people
Yeah.
need to extraneously add PDFs or any data that they can't pull in through the connector in the way you're talking about, you can dump it in Claude in this particular way. So keep going.
Right. Yeah.
Okay,
Yeah.
so now-
I finish up that point a bit. You create a project, you call it My Health or My Son's Health or whatever.
Yep.
You create the project. On the instructions, you type in what, these are my health records. I'm going to ask you a bunch of questions about my health. So that's the instructions. You guide it. And then if you have any files about yourself on your health, you load it in there. And the reason why you do this is that gives you the context of a project. And you might have multiple chats. You might have, I saw my doctor, I had these things, I want to talk about this. Or you might say, I'd like to build a gym plan and manage my exercises in the context of my
that's exactly what I do in my project. I've done multiple things with it.
It's a good practice, and if your spouse write it different, then it sort of creates a sandbox for things to be done on.
So I just want to showcase here, like this is the Josh Mandel Health Skills tool, which you can just access by going to healthskills@joshmandel.com. And so this is basically the direct connection to your Epic provider. So this is like your data is not on Tefka. You tried, you barely found anything. You can go on this, and this will definitely retrieve everything through the direct connection in Epic. And you can go in here and you can search, various so like
but
here's
only you're saying
Health
only
Network.
Epic, you're talking about only Epic providers or all providers?
I think it's only Epic right now, but I think he is working on adding other. Again, there's other people, like I think FlexSpot also has some of this kind of functionality. There's many different tools to do this.
And
many
then
different companies in the space.
You mentioned you have an MCP that people can use for the same thing on GitHub.
Yeah, so I'm actually working on also
so you're showing I know I'm pushing you but I'm trying to be time sensitive. So you are showing people how to use his tool and how to log in. You are now logging in using his tool. And this happens with everything. Just so everybody knows, whether you use the HealthX connector, whatever you use, it is going to take you to the portal, and you are going to have to enter your credentials in.
Yeah. And every time you're logging in through the patient right of access, you're going to see this. And it's funny, like this is all the stuff that you have that is kind of considered standard health information.
Yep.
It's not everything, but like it's standard health information. And you see this little, how long would you like to share this data? There's not an infinite option. So like they apparently, from what I heard from Brendan Keeler, is that Epic does allow for this to be shared indefinitely, but most health systems choose to time box it.
Yep.
So like this is annoying because this means that you have to keep relogging in. You can't just do it once and be done with it. That means you have to keep coming back. Let's say you
every
say
year.
1 week. Yeah.
So okay. So now you're going to allow access, and now this is
here it is.
Perfect.
Yeah. So here it found all kinds of stuff, and Josh actually made this so that you can apply,
that's cool.
redact. Yeah, we can redact. So you can send the data then to your AI, which in my case is, Claude. So then when you go back to Claude, I say complete. It should be able to access now that data that was just retrieved.
Did you ask it above to look for that, or did you just said complete and it was able to know that was happening?
Yeah, so you can see it's now finalizing, decrypting the health data, which it doesn't store the data anywhere. It's all on your local machine. So again, here's the thing about it. It's not perfect, right? So this one said it did not see it, so I'd have to do it again. Let me see if it'll allow me to do
Well,
it
let's keep
again.
going. So let's not worry
Okay.
about that. So that's just an example, though. So this is the worst. Brent, if you want to quote Brendan Keeler, I'll quote him again via Price Ancona, which is, this is the worst it's going to get. So this is as clunky as it's going to be at this moment in time. I don't think it's ever going to get any worse.
Yeah, so I might not actually have much data in there anyway. So like the point is what I showed before, I was able to connect. So like you can connect your data different ways and bring it in. That's the point.
But this
like,
isn't, just so everybody knows, this is
yeah.
encrypted. It's safe for you. It's on your local machine, as Gene said. So
Right.
like, it's not like you've got prying eyes of whoever is going to suddenly expose your health data. And as Carter said, get in there and start trying, because the more we do this, the more we can move back upstream and start to shift the dollars.
Yeah, so like the good part of it is that now you with AI, you don't have to like sort through a ton of data and yourself try to make sense of, which is what had to happen like before if you tried to do this.
Yep.
Like,
So,
and you know, there's whole departments of data analysts and all sorts of data scientists that are employed by provider system, by health insurance companies to do this effectively. Now with AI, we came to such a level of progress that it can do it better than 90% of data analysts. So
yeah, okay.
you can load your data and get your own insights about your own health.
So now
Which is
you've
the game
shown
changer.
people, tell people very quickly about the GitHub option, and then let's move into the dashboards that you created and how people can kind of play with that. Let Carter ask any questions as well. I'm sort of dominating this flow.
No, keep going.
Yeah, so like basically what I'm working on is a similar flow to how you're able to connect via HealthX or Health Skills. So I have my own MCP that will allow you to basically generate what I created. So you'll be able to generate the health insurance summary and as well as your own health journal based on your clinical data that will aggregate and give you that nice
Awesome.
kind of view, right?
Well, so show us what you built. Let's go back to that.
Oh,
sorry, I thought I was on mute.
That sounds bad.
Yeah, apparently there was an evacuation order for my area, but I'm you know what, I'm not in that area, but apparently there was but it's been canceled. I didn't even know there was one. Anyways.
Yeah. So which one did you want to see? The health insurance or the
Let's start with the first you were showing, which is the health dashboard you created.
The health insurance one. Okay.
Yeah. And then we'll go to the other one.
All right. Let me bring that up again.
And folks are being awfully quiet. And we have a lot of people on. So anybody that has any questions for Gene, now is a good time to ask them. And it's okay if this is sort of blowing your mind and you're like, I don't even know where to begin. We're okay going to answer that. Or if you're really advanced and you understand what an MCP is and you're playing on OpenClaw and you're doing all these things, we can talk that way too. So just throw it at us. That's the point of these. I at least put on a green t-shirt since it's St. Patrick's Day. Happy St. Patrick's Day. Gene's got his green on.
Yeah. Are you Irish?
Yes, actually. I am Irish. My mother's side of the family is Irish, and then my mother-in-law, so my husband's mother's maiden name is Murphy. So not only do we have Irish, we also have Murphy's Law embedded into life. And life is very much Murphy's Law for us regularly. So
we can, as a side note, if people want to follow up, or Gene, are you on Substack?
Yeah, so I'm Fire Data Guy on Substack. Just hit 500 subscribers. Woohoo!
That's great. we can add this. I'll figure out. We can put a chat going on Substack
Yes.
for Aptos.
Okay. So here's the dashboard that Gene created.
Yeah, so I can do all kinds of visualizations of like kind of like your cost breakdown. Here's the different providers, how much are you spending by provider. So this is the kind of stuff that's like generally would be available to your like executives in your health insurance company. This is what they pay whole teams of data analysts to do this kind of stuff, do all sorts of analytics stuff. And it was funny because when I used to work for one of those health insurance, I'd be very frustrated because I couldn't get my own data and all the insights. And you would be, very surprised how much analytics there are that are available, right? But they don't go outside, right? They're not surface to the patient. So to be able to do something like this is like really, really crazy. You can see like what are currently unpaid claims, what is going on,
This is
Oh, I
like
like that network savings. That was cool. So you
Yeah.
could actually see the value,
yeah.
or you could just see the arbitrage.
Yeah. So
your
there's
ID on Substack, so I can add that.
FHIR, right? Or FIHR? Is it F? I'm getting it wrong.
yeah, it's
Sorry to distract.
evestel.substack.com.
What's your username? I'll figure it out.
Yeah, so if you go evestel.substack.com, it'll bring you up. And this is my Substack. Okay. So like, again, you can see like action items, like we analyzed all of your preventative care, all of your claims data, et cetera, et cetera. So,
And what is it saying? I can't read it. So what is it? What kind of insights is it giving you there on this insurer?
It's just kind of telling me, just because I switched coverages to my spouse's health insurance plan, so it's telling me I have a lapse of coverage.
Okay,
But
gotcha.
so it just doesn't know that I switched we switched to her insurance. But like, call Cigna about an outstanding payer amount. So like, you have some claims that are outstanding, but for some reason they haven't paid. Verify that you haven't been double charged in $95 of patient owed pharmacy copays. And confirm your behavioral health providers are in network and then in your plan. Follow up with a colonoscopy biopsy results from the PCP and Dr. Cedar. So like all of these things that are like, yeah, I should probably do all these things, right?
Yeah. And so
but
the
here it's
MCP
like, yeah.
that you're finishing, that people will be able to find it at some point.
Right. So basically what it's going to be doing is same thing that's kind of like the Josh Mandel Health Skills tool does, which is it connects the data, it lets you find it, connect it, and then bring it in safely into Claude so you can do this, is exactly what I'm doing. And it's going to basically create these type of things that I've created for myself. So you'll be
Gotcha.
able to say, go to Flexpa, connect all of your insurance data. It'll, based on who your insurer is and your login information, it'll pull all the data that's available, and then it'll generate a dashboard like this. So inside Claude, which is the cool part because you don't have to go anywhere else. There's no other portal. It's just all inside Claude.
Okay. Carter, you have any questions on this one?
No? All right, great. Maybe you cover a lot of the stuff on your website too? On your
on the Substack. Yeah, I write about all this stuff and, just talk about all kinds of things in the industry and interoperability and obviously fire standards and things like that, which is basically the fire standard is just how's this data all exchanged and what format that data has to be in so that it effectively flows, from one system to another. Because the only way to do this repeatedly is to be able to use consistent data, standards and all of that. The type of data. So when you're talking about a condition, the system knows that you're talking about the same condition, right? Immunization is immunization. In the past, every EMR, every system has basically had its own standard. Every health provider network created their own data warehouses where they had a million different ways that they define what a condition was, for example, right? So with fire, we have these US CDI standards now that define all of this data very specifically and in a very standardized way, so that you know your local PCP and your mom's cardiologist in California, they all define it the same way, right? They code it, and it's the same coding standard.
So I'm going to lob this question to you, Carter, because I can already hear how you're going to answer it. So the question in the comments of what percent, because I get this a lot and I always like your answer better. I sound too squishy. What percent of the US population will successfully be able to use a tool like this? Question mark.
I would
Let's
hope.
let Carter
Yeah.
go for this one.
Yeah, go ahead,
I
Carl.
always like when he answers questions like this.
All the setup. I don't know how to answer it. I think it's I think that 3 or 4% maybe, but I think that if those 3 or 4% do dig in and start asking questions from it, you'll see all this interconnectivity stuff will get worked out. Once there's
Exactly.
pressure from consumers, somebody will emerge and dominate, and it'll get cleaned up because,
I mean, a company like HealthX, for example, I mean, these are all things they can solve.
They'll figure it out. And I think it's important if we're thinking about where to invest and where the technology is. I think it's a very common pattern. The first thing is, okay, we got to get the interconnectivity, and people think that's the hot spot. But it's once you get the interconnectivity going, then what happens? So, Google search was interesting, but once you can start putting advertising on top and Gmail on top, it changes. And I think consumers will let the people who do integrate take some value for doing that on their behalf. So that sounds sort of geeky, but I think we'll see a quick evolution. So some people will get in and do this. So more people will post, more people will demand it. They'll go into their doctor and say, I demand this. And then the doctors will respond.
Oh.
And the barriers will quickly fall down. It'll be very difficult for someone like Epic to if it in fact Epic is trying to block people for their particular advantage, rather than it just being that they're screwed up, that block will disappear. It will fall. The more consumers that are saying, I want access to this in a streamlined way.
Well, I mean, there's a statistic that I raised last year, which was that it only takes 3.5% of the population for a revolution.
Oh, okay.
And
well, then
so
there we go.
But
like, I guess I hit the target right if I said
you did,
3 or
and Christo agreed with you and said 4% agreed. So we did well. The layup was, I laid it up perfect. So let's jump now into the other piece that you built, Gene, and then I have I'm going to show the funny. I'm going to land the plane with the funny Ma Hospital because everybody loved it. It's a little video clip that I will close this out with before we.
Well, hold on, Gene. Going back to one thing, when you got that JSX file,
So JSX is when Claude creates a dashboard for you. It's created as a JSX file,
Exactly.
and then it's
and how do you
local.
tell it
So
is
essentially, it's actually your own analytics tool, right? So not only does it create a JSX tool on your local machine, it saves it in your artifacts toolbox in Claude, and then you can publish it and actually share that link with your family members, with your provider. That's the power of it. It's not just something that's
understand the setup.
it's not just creating like an image, or it's not just creating like a Excel spreadsheet that you ask it to create. This is actually a live dashboard that's interactive that Claude creates and makes it available so that others can access it via your link that you can share, right? So that itself gives you so much power as a patient, because now you're in control of your own data, that you can, not just data, but the insights, right?
Well,
so
and Claude does this. This Carter is like.
Can I ask a different question? Just to, please. How do you get to that point? Is that done on chat? and you say create a dashboard JSX, or how do you?
For
How
me,
did you?
I will tell you, Carter, this is the perfect example is when we were on with Ryan a couple weeks ago, and you had Ryan start to write out, we were going to do a Claude coding session. We were going to do a vibe coding session. And you remember how he put his whole...
Hold on, pause. Sorry, Alan. I just want to note the very specific instructions. I don't want the setup. I just, the instructions on, could you do that in Claude chat or co-work?
No. You do that all in chat, all in chat.
You did in chat. And so what is the general prompt that you give it to have it created?
So first of all, the way that I'm doing it is I'm actually creating what's called an MCP app in Claude Code. So Claude Code creates the MCP app, and that's what I'm going to share on my GitHub.
But
you can go into Claude and ask it to create you a dashboard, and it will do that.
And is that the prompt? They're really trying to make it very easy for the end user. If they want to create something like that.
Create me a dashboard. Create me a dashboard. This is conversational AI. Conversational AI. So you ask it to create me a dashboard, and it is able to do that based on what you're asking it to do, right?
What I was going to say is it is getting smart enough that my experience is why I referenced Ryan is I have multiple times prompted it in the last 2 weeks where it is either without me telling it, it's either created a JSX, it has created an HTML, it has created a precursor to a Claude Code project, exactly what Gene said, so that I have a usable interface that I can share with other people without me prompting it to do it.
You're frustrating me.
I know I am.
People who are listening, I'm trying to give them a basic understanding of what they write into the prompt to get the answer. Not, it's been done, a lot of people have done it. I want to give as direct an instruction to a user so they know what to do next when they get off this call to generate that. And I think we've got the answer. If you're in Claude chat and you say, we've been talking about this data, I'd like you to create a dashboard of this, it will then generate that. That's what you're saying, Gene.
Yes.
Okay.
Yes, exactly.
Did you prompt it to add any elements contextually, or did it figure this out for you?
I have to iterate a couple of times, but I mean, it does a pretty good job out of the box because it inherently it understands the fire data. So it knows, essentially it knows fire. So it knows how to structure it so that but if you have specific goals, give me recommendations and insights based on this based on the data, right? If I like timeline views, so give me the timeline views. Give me things like this where I was able to see by year, this is all the things last time I had flu was in 2018, so things like that. When you have significant healthcare, interaction with the healthcare system, you have a lot of data, and the benefit comes from this thing is aggregating it all for you so that you don't have to be the one doing it.
Into a context for people that are listening that are overwhelmed by this conversation. So I go into Claude chat. I might upload 2 or 3 blood test reports. I can then say, can you please create a dashboard of these blood test reports over time? It will then, boom, create the JSX right there in your session. It'll create it. And then you can say, you know what, now that I think about it, can you also add this blood test? Or you can say, give me a chronological order. You can start asking, and then it will update that JSX.
Absolutely.
Okay.
Yeah. And then if you like it, and then you've got to a point where you're like, oh, this is exactly what I'm looking for. I want to share this with my uncle and my aunt, right? So that they know what I've been going through. Boom. It creates a link for you. You just text them the link, and then they can open it on their side, right? Same thing with your provider. Hey, I did this analysis of my own health data, and I wanted to share this with you. Can you take a look at it? Boom. You can share it.
Good.
Do you want to share anything else, and then I'll show the funny video?
Yeah, I have to unfortunately hop off.
Yep.
Sorry.
It's fine.
And then somebody else on the line just needs to, do you want really practical next step stuff, or do you want, I'm feeling a little strained in terms of how do we really get people to the next step, or do we talk strategically about this stuff? And we need to build a tribe of people who are putting pressure on the system for food is health. And that means equipping you. And we'll do this. If there are people that want to say, yeah, I am willing to sit down for 2 hours to learn how to Claude code. It is worth our while to sit down and teach you that, so that we have one more person on the team, just as long as you'll pay that forward and do that to somebody else once you get good. That's how we build a tribe. And with that, I've got to go do a phone call I don't want to do.
Okay, bye. So for anybody that's still on,
Thanks, Gene.
thanks, Carter.
Thank you.
So for anybody that's still on, would love for you to answer Carter's prompt in the comments. Gene, do you have any other information that you want to pop up for folks? I'm going to pull up this video.
So yes, go ahead and subscribe to my Substack, and I'll be sharing the tool that is going to let you generate all the same stuff in Claude very easily with no technical knowledge, I promise, and safely and securely. So yeah, subscribe to evestil.substack.com and look out for that. Thank you. Thank you for having me on, Ellen.
Yeah, well, you can stay on for the funny video, because then we can like riff about it for a second. I don't know if you've seen this. So let me
I think I have. But yeah.
Well, I put it up yesterday. So this is for everybody. We're going to shut it down on a funny note. If you haven't seen this, SNL did a so you have to know that my husband and I have a running thing. He came up with the term health spittle. It drives Carter crazy. But it is kind of a running joke. And so I opened up an email from my buddy Ron Stout yesterday morning with this video that is just, it is hilarious. So I'm going to play it for everybody.
What do we got? Lady flaps her 80th birthday party. Delayed breathing, blood pressure's through the roof.
For people who love the pit.
No effusion, good lung fighting.
Likely stroke.
But can't stand its phony liberal science.
Stock's going crazy. Proceed with thrombectomy?
Not until we have a definitive diagnosis.
From producer Robert F. Kennedy Jr. and the team who want to make America healthy again.
What she needs is a steak. She needs protein, people. Give me beef tallow and 6 raw eggs stat.
It's Ma Hospital. From producer Jillian Michaels and the Facebook group Beach Moms Against Vaccine Tyranny.
The testosterone is crashing. I need 60 cc's of bull semen now!
Comes a show set in the high-stakes medical crucible of Orange County, California.
What's the situation?
Car accident, femur fracture, and trauma to ribs 2 and 5.
Oh, my leg! Sir, are you up to date on your vaccines?
Yes. Loser. Okay, treatment, Dawes.
Okay, maybe methylene blue and a full moon ceremony.
Might work. Manning.
Whey powder, anal probiotic, and a sound bath?
Not quite. Tanner.
Triple dose of Alpha Brain and a cold plunge in Blue Jeans.
Bingo. Get on it.
Oh no, he's in shock! He's in shock!
Uh-oh.
I need all hands. Tanner, power up.
Yep, got it.
Clear. What the hell?
This skin's gonna look really nice.
I hope next time you question my diagnosis, you'll do it in private.
Stay in your lane. I'm the doctor here.
Excuse me? I'm a certified energy healer.
My Instagram account, The Wellness Cheek, has over 3,000 followers, so don't you dare try to tell me how to do my job.
I need some air. I'm going outside to sun my taint.
And in Ma Hospital, emotions run high.
You could be anywhere. Why are you at my hospital?
You wanna know why I'm here? Huh? Fine. My parents died from the COVID vaccine.
Oh my God, I'm so sorry.
Yeah. Found out they got it and I shot them. I'm going to lunch.
5 stars raves the Liver King.
Measles ain't gonna cure itself. Let's go. Come on.
How's she doing?
She's on life support. She was fairly healthy before the accident. The only thing is, she's a vegan.
Well, nothing we could do. Are you insane? What the hell are you doing? Are you crazy? Not in my hospital.
If your favorite character from the pit was the guy who punched the nurse in the face, you'll love Ma Hospital.
Clear the area. Boston's bringing one in himself. Coming through.
With a special appearance by RFK Jr.
Coming through. Come on. Help me out here. Is that a bear?
I hit him with my car on the way over here. Prep him
For surgery?
for jerky. It's been dead for days, but the meat's still good.
Prep him. All right, let's move.
I'm proud of each and every one of you. You've been told over and over you're crazy. What you're doing is dangerous and irresponsible. But you did it anyway.
She needs some more raw milk, now.
Maybe it's the brain worm talking, but I love this team. Now drop and give me 50. Yeah! Belly button to the sky.
Ma Hospital, coming soon to the Daily Wire.
And that, my friend, is how you shut it down. So thank you, Gene, for joining.
Thanks, Alan. Thanks for having me
I'm
on.
sure that we will continue the conversation. Thank you, everybody
Yeah,
who joined
for
us
sure.
today. All right.
Bye. Thank
Okay,
you.
bye.
Bye.